So we did a study looking at patients with diffuse large B-cell lymphoma who had received CAR T therapy versus a similarly matched population who had not received CAR T. And by similarly matched, I mean it's a relapsed refractory more than one time patient population. And we took this data from our global patient survey, which we do every 2 years. And so this was the 2020 data that was analyzed. And what we saw is, even though the numbers for both groups are small, and we do see that patients with CAR T are not quite as involved or don't feel as involved in their healthcare decision-making as patients that have diffuse large B-cell and relapsed refractory, but have not had CAR T. And that's an interesting point for us. It's just looking at how well are these patients informed about what's going to happen with CAR T, how prepared do they feel, were other options presented to them like clinical trials or something else. We've done quite a bit of work in general looking at patient information levels, because we do have research showing that a highly informed patient actually has a better overall patient experience. And so when you're looking at CAR T therapy, often these patients are what we would call highly experienced. They've been through many different treatments before. They've at least had their initial chemoimmunotherapy. So you would think that they would have a good understanding or baseline of treatments and what might happen to them moving forward. But that doesn't actually seem to be quite true. And so there might be an information gap there, something that can be addressed to make sure that patients have good quality information so they can make adequate healthcare decisions, especially with something as big as CAR T, that of course, through media, many patients believe is curative for everybody, but in fact it may be curative for some, but not for all patients. So let's help give them the information they need to make their best decisions.